Hi, I'm Dr. Anna Maria Macaluso Davidson, Vice President of Employee Health Medical Operations with Memorial Hermann Health System.
I'm JC Jaton, State Representative for House District 26 in the Fort Bend County area. And so I guess we'll start off with the first question, and that has to do with vaccination, the flu vaccine. And can you tell us a little bit about the flu last year, or lack of flu, and maybe what we might expect this year?
Sure. So last year, I think we've been really in a very unique situation the last 2 years, more or less. And so last year, flu definitely looked different. We saw it in much lower numbers than we would traditionally see. And I think there's reason for that. Everything that we're doing to keep us from getting COVID also helps prevent the spread of the flu. So we're wearing masks, we're keeping distance. We've been vaccinated, so that also looks different this year. But all of those protective measures, washing your hands, cleaning surfaces, that helps curb the spread of flu really effectively as well. And so that's why we didn't see very much last year. This year, there's more activity, meaning people are out and about more. We've got the vaccinations for COVID, which is great. We're encouraging flu vaccine to help prevent illness as well. So we'll kind of see. We're starting to see it in the community, but it still is a little low right now. We expect it to peak a little bit later on.
Gotcha. So how important is it going to be to get your flu vaccine?
I think it's really important. We pushed it a lot last year as well, just in trying to educate, and I think the same is true here. So flu for some people can seem really minor, it's no big deal, why do I need to get a vaccine? But for a lot of people it's really serious. We see millions and millions of cases every year, hundreds of thousands of hospitalizations, and even a significant number of deaths. And so it's not just the elderly, we also see it in young children. It can be a really severe illness. And then, adults kind of all different ages as well. So getting vaccinated helps reduce your risk for getting sick. And if you do happen to get sick, you always have more mild symptoms. So either way, it's a win. And then we keep folks out of the hospital, which is great. And you're well at home and hanging out or doing whatever is your normal.
Gotcha. So how are flu vaccines different from year to year?
It's a good question. It's a little confusing when you look at vaccines, especially flu vaccine, I think even compared to other vaccines, and just understanding the cadence. Why do I have to get it every year? Why is this different? So what they do, the flu viruses like to mutate, more or less. We've learned that actually, and we're seeing that with COVID. So the same thing with flu. It's not big shifts, it's just little shifts. And so sometimes that means that the antibodies that we have won't bind as well because there's a little bit of a difference in the virus this year compared to last year. So the flu vaccines will be tailored, trying to match what they're seeing as more dominant strands or more likely strains to be circulating in the community. So that's the reason for getting this annual booster or annual dose of flu vaccine, is trying to make it the most effective or more effective at preventing illness.
Sure. So after a year where we didn't have this big explosion of flu last year, is there any concerns or thoughts about how the flu vaccine is going to be going into this next season?
You're right. We didn't have, a lot of times we would look retrospectively and say, okay, well, it was really effective, or we had 60% effectiveness or efficacy, and so we don't have that because cases were so low. So that is kind of not a delta, but a variable in the equation. One of the things that's also nice is that they're using new technology. So there's ways that we can make vaccines and apply technology, meaning we can make it more specific and more targeted to a specific virus. And so with those abilities kind of coming on board, I think that's a positive thing, to be able to use that technology and apply it. You can make vaccines faster, and you can make them more targeted as well.
Was that a result of the vaccine or the COVID vaccine from last year, or has that technology been in the works?
It's been in the works
okay.
Over the last decade, and so coming into play. But yeah, not just as a result of COVID.
Okay. What about, do you have any concerns about someone getting the COVID vaccine and then the flu vaccine, duration in between the shots or anything like that?
It's a great question. No, actually, you can get them at the same time. I actually got my booster and flu shot at the same time. Some people can be worried, like, I don't know, like side effects, am I out of work the next day or school? Really, I think flu vaccine is very well tolerated, very minimal side effects. Your arms kind of sore, like you had a really good workout or something on those muscles. And then COVID vaccine, a little bit more systemic side effects as you're building that immune response, but really just well tolerated. Take Tylenol, and you're good to go. That or Excedrin migraine, I think, are fine. Something over the counter like that.
Okay. But
there's not a timing issue, so you could get them the same day. If you got them 2 weeks apart or a month apart, it's totally fine.
Gotcha. And I think that's a big concern with a lot of people. They get the second shot, especially with COVID, and they get more symptoms, and it probably
Yes.
brings up some memories of getting flu shots and sometimes feeling ill afterwards. What's the likelihood of actually feeling ill after a flu shot? Yeah.
I think, well, I'd say fairly low. Common side effect is your arm being sore. That's the most common for sure. And sometimes you do have a little bit of where you feel kind of chills, a little bit of achy, but generally it's really well tolerated, and the soreness is really the main thing that you see. And then within a couple of days, you're good to go.
Gotcha. Then what about ages? Are there concerns with different ages, especially with getting the vaccine?
So flu vaccine's recommended 6 months and up. So that's a huge population, right, that's eligible for the flu vaccine. And it's important in the younger kids. We know that they can have more severe outcomes in that group. And then if you're an adult or older, regardless of if you've got chronic health disease like kidney disease or heart disease, it's important for you to get the vaccine. The elderly, if you're 65 and up, you could get a flu vaccine that actually is stronger, which is good. Our immune systems kind of wane as we get older, and so it's really targeted for that population to help give them an extra boost for their immune system.
Gotcha. And so, COVID's still top of mind, and we know that kind of impacts elderly communities more so than maybe the youngers. When it comes to the flu, are younger people being impacted just as much as older?
Yeah, you're right. We look at different populations. So you're right, COVID, more serious outcomes tend to be in older adults or those with health conditions as opposed to the young, which is wonderful. We see more hospitalizations with flu in the younger pediatric population. So for some, of course, it's fine and generally mild, meaning you can stay at home and you recover. But we do see more serious outcomes in younger children, which is also the push or the reason for the recommendations to get those vaccines from the American Academy of Pediatrics and even the American College of Obstetrics and Gynecology. So they recommend if you're pregnant that you get the flu vaccine as well. So one of those reasons, pregnant women, there's just a lot going on physically when you're carrying a child and that child's growing. And so it can be harder if you get sick and you're also pregnant, it's harder for your body to handle both. So we can see increased hospitalizations in that group. One of the benefits, if you're pregnant and then you have your baby, you're going to be producing antibodies that protects you from flu, and your baby gets those that same benefit. And so that's true like when they're in utero, but then also after they're born, they will carry some of those antibodies with them, and it really helps to protect them in those first few months. And the same thing for breastfeeding, you're constantly giving your baby antibodies that keeps them well. So that's the reason behind why you want to get vaccinated when you're pregnant.
Gotcha. Good. And I guess a final question. In addition to the vaccine, what else can we do to prevent the spread of the flu this season?
Good question. So a lot of it I feel like is a little redundant, right? Things that we've learned that we may be tired of doing. So washing our hands, cleaning high-touch surfaces, maybe just being cautious too. If you're starting to feel sick, it could be allergies, but it may not be, right? It may be something different. So being more cautious maybe than we used to be when we're starting to feel sick. It's easier to get tested for COVID, but then also for flu. And kind of going real quick and say, well, let me just see if there's something else going on. The good thing with flu, generally speaking, if you're kind of watching your symptoms, it's really abrupt. Whereas a cold can kind of come on slowly and there's different symptoms. Usually you feel like you've been hit pretty hard and pretty quickly with flu. So it's a good marker, like, something else is going on here. And then I'd say, so staying home when you're sick, like we talked about. And then, masks can be helpful, but just keeping your distance. It's a respiratory virus, so washing your hands. And if you sneeze or if you cough or you blow your nose, then you wash your hands after as well.
Sure. Of course. I guess I lied. I got one more question.
Yeah.
At what point in the flu do you end up more contagious?
So that is a great question. Generally at the beginning, so a little bit before your symptoms start, we'll see that you can be contagious, but then definitely those symptoms are starting. When you have fever, 24 hours, even after you've got fever, that's kind of a window where you're looking at for being potentially contagious. And it's in that earlier kind of time frame. Some folks, it takes longer to kind of like more than a week if you've got symptoms, depending on how bad you're sick, but the infectious time period really is at the beginning.
Okay.
If you've been exposed to somebody that has flu, then you're looking at kind of a 4-day incubation time frame. So it's much shorter, which is helpful just to know, and even in planning and things, it's different than what we've been dealing with COVID. So it's a much tighter time frame.
Okay. Good. Any other questions I missed there?